Hello, good evening to everyone and welcome back to this channel, The Upcoming Doctors. So in this session we are going to discuss about the topic the anastomosis. So before going to discuss the topic anastomosis, let us have a overlook of artery, vein and the capillary. Right, this is the artery and the capillaries will be present like this, and then there will be the vein. So the artery and the vein are communicated with the help of the capillaries. Okay, the capillaries will be present in between in them, the artery and the vein. So this is the basic network. Coming to the anastomosis, the pre-capillary or the post-capillary communication between the neighboring vessels is called anastomosis. Okay, in between the neighboring vessels means artery and the vein. Okay, artery and the vein will have the communication. So this is the capillary, whatever present in front of the capillary, in front, that will be the pre-capillary communication, and whatever present after the capillary, that is called post-capillary communication. So the pre-capillary or the post-capillary communication between the neighboring vessels is called anastomosis. And the circulation, whatever the blood flows through this anastomosis is called collateral circulation. Okay, and coming to the types of anastomosis, we have three types mainly: arterial anastomosis, venous anastomosis and arteriovenous anastomosis. The arteriovenous anastomosis, otherwise called as shunt, this is very important, remember the point. The arteriovenous anastomosis, otherwise called as shunt. And coming to the arterial anastomosis, the communication between the arteries or the branches of arteries is called arterial anastomosis, and between the veins or the tributaries of the veins, it is called venous anastomosis. Always remember, the artery will have branches and veins will have tributaries. So the blood from the tributaries will, like a river has tributaries, no, same in that way the vein also has tributaries. All the blood from the tributaries enters into the vein. Unlike the arteries will have branches. Tree has branches, no. Likewise, from the main artery, the blood flows into the several branches. This is the main difference in between the artery and the vein. And coming to the example, that is dorsal venous arches of hand and foot will comes under the venous anastomosis. So the arterial anastomosis again consists of two types. It may be actual or potential. What do you mean by the actual? Arteries meet end to end, so they will have a communication that arteries meet end to end. Examples are palmar arches, plantar arch and circle of Willis. The circle of Willis again a very important thing which can be discussed in the further sessions. And coming to the another type of the arterial anastomosis, that is potential anastomosis. Communication takes place between the terminal arterioles, which means terminal. Okay, examples are coronary arteries, cerebral arteries. And the communication dilate only. Dilate means it get increases like this. If the artery is like that, dilation, after dilation it will become like this. So the communication will be dilated only during the gradually for the collateral circulation. And but if any sudden occlusion of artery happens, then anastomosis may fail to compensate. Now what does this mean? First of all, the coronary artery is present like this. We can see in another picture, like here you can see the coronary artery, right? In the second picture you can see the potential arterial anastomosis between the coronary arteries. Now what does this mean? Right, here are the main artery. This is the left coronary artery and this is the right coronary artery present, and these two arteries are present. First of all, the arteries, the blood flows through this main arteries, that is the left coronary and the right coronary artery. The arterial anastomosis will be present here, but it is the potential one, because it cannot, if any sudden pressure will occur in the heart, like in the heart attacks, mild heart attacks, like things will occur, so that it cannot compensate the blood which actually should flow this through this main arteries, because remaining arteries will be of smaller size compared with these arteries. So the potential arterial anastomosis will not fill up the main arterial anastomosis, which actually should do, so may fail to compensate. The sudden occlusion means blockage of the main artery happens, then anastomosis may fail to compensate. So that's why the heart attacks, mild heart attacks will occur, or the heart failure will occur. And coming to the venous anastomosis, we already discussed that examples are the dorsal venous arches of the hand, at the same time foot. And coming to the arteriovenous anastomosis, which is otherwise called shunt, here it is a communication between the artery and the vein. Actually the artery will be present and then capillaries will be present and then vein will be present, but unlike in some cases, the artery will directly, this is the artery and this is the capillaries will be present in between the artery and the vein, But sometimes what will happen, the artery directly communicates with the vein. This is called the arteriovenous anastomosis, otherwise called shunt. Okay, remember this point, otherwise called shunt. Whenever they serve the function of the basic activity of the organ. This is again an important thing, which serves the basic activity of the organ, the shunt, otherwise called arteriovenous anastomosis. And now what does it function is, what does it do? When the organ is active, the shunts are closed, which means the blood will not flow from this direct pathway. It will flow in normal pathway, that is from artery to the capillary and capillary to the vein. But in some cases, like when the organ is at rest, okay, at rest, then blood bypasses the capillary bed. What does it mean? The blood doesn't pass through these capillaries and blood directly flows from artery to the vein. Okay, this will be from artery will be present, capillary will be present, vein will be present. This is the actual pathway which, I'm really sorry, this should be the actual pathway which should be followed. But from directly artery to the vein, when does it happen? It happens only whenever there is the organ is at rest, and then the blood will bypass the capillaries. It doesn't passes through the capillary, it will directly flows from artery to the vein. This is a very important thing. Then the shunt occurs. So the skin of the nose, erectile tissue and the sexual organs, okay, and this comes under the, like under the influence of the sympathetic system. The shunt vessels, whatever the shunt vessels will present, I'll write here the skin of the nose. Okay, remember the skin of the nose and some erectile tissues. Erectile tissues which are actually the sex organs which can participate in the erection, okay, erection of the organs. So, and the tongue also comes under this shunt. The artery and the vein will directly communicate with each other, and they are called, the vessels are called shunt vessels, and they will be under the influence of S for S. Remember, like this, S and S. Shunt will be under the influence of the sympathetic system, so it is always active. And this is all about the anastomosis, and I'll show the picture of the anastomosis. Here we can see the actual arterial anastomosis forming the palmar arch in the first picture. We already discussed arterial anastomosis is of two types. One is the actual arterial anastomosis and second one is the potential arterial anastomosis. So in the first picture we can see the, this is the first picture, we can see the actual arterial anastomosis. We can find the end to end. This will be, one will be like this, one artery will be coming like this, and another artery coming like this, and we have the end to end communication. So it is the actual arterial anastomosis. And coming to the second picture, we can see the potential arterial anastomosis between the coronary arteries, mainly seen in the heart. If main artery will block, then sometimes the anastomosis may not, which means which fails to compensate. That's why it results in the heart failure or mild heart attacks like this. Okay, this is all about the arterial anastomosis. And coming to the other point, we have this is the arteriovenous shunt. Okay, the arteriovenous shunt, arteriovenous communication, otherwise called as shunt. We can write AV shunt, which means arteriovenous communication, also called as shunt. Okay, so the arteriole is present and the venule is present. So this is the main communication which can occurs. Normally the artery, this white color is the capillaries, okay, artery and the capillaries and then vein. This is the normal communication. Here also artery, capillary and the vein. Here also artery, capillary and the vein. But in some cases, like when the organ is at rest, then directly from the arteriole to the venule, it will passes the blood. Blood will bypass the capillaries. It doesn't passes through the capillaries and directly flows from arteriole to venule. This is all about the anastomosis. So please like, share and subscribe to the channel. Thank you for your support. Thank you.